This is a patient referred from 400 miles away. She had cataract surgery with Panoptix lenses placed a year previously. She's status post-YAG laser. She came up and we did lens exchange with vitrectomy in the right eye on Monday. This is 3 days later on Thursday, and we're now exchanging the lens in the left eye. We're going to go ahead and do a pars plana vitrectomy and floater removal while we're here taking this lens out. These are pars plana trocars that are being placed for the vitrectomy prior to removing the lens. Her problem with these lenses was poor vision, glare, halos, and she felt she could not drive at night or do her job. So here we placed our trocars. We filled the anterior chamber with viscoelastic. We've made the main incision, and we're using viscoelastic on a 26 gauge spatulated cannula to gently slide under the anterior capsule where it adheres to the optic and eject dispersive viscoelastic. This is to free up the lens, which is adherent because it's been in place for a while. We then switch to cohesive viscoelastic, which provides a better dissection wave now that we've created some space between the optic and the anterior capsule. And we'll try to use the viscoelastic to dissect out some of these adhesions and free up the haptic, which is pretty socked in here from fibrosis. I'm now going to retract the anterior capsule and reach under, and using a micro forceps grab this haptic and try to strip the fibrosis off of the haptic. The haptic is sort of cocooned in place with this fibrosis, and so we're going to sweep this off the end of the haptic, the fibrosis, so we can free this up. And we want to do this without damaging the capsular bag remnant or the zonules that support it. So now we've been able to get this haptic out of the capsular bag, and we're going to kind of crab walk the optic up through the rhexis opening and work on the other haptic. So now this is the only part of the lens that's remaining in the capsular bag, and we're going to start sweeping the fibrosis off here, and this side's pretty well stuck in. So I've made a decision that I'm going to work on that later. I'm going to just, for now, cut the lens at the haptic optic junction so I can get the main part of the lens out and worry about that haptic later. It'll be easier to get out without this in my way. So we'll go ahead and cut this in half using a micro scissor. So we cut through the lens. And now we can take the whole thing out in two pieces through a small incision. So this now comes out, and the other half, we'll spin this around and take this out. And when we do this, we want to protect the endothelium by using a Sinskey hook to hold the haptic back as we pull out, because otherwise it could spring up and damage the cornea. So now we're going to go after this haptic, and it's much easier to remove this now without that lens in the way, so we can pull this out at a better angle, free it up, and remove it through the main incision very easily. I'm holding on to it so it doesn't fall and back. And now we pull it out. And now we'll go ahead and do a complete vitrectomy. This patient was bothered by floaters. That's very common. Patients with floaters tend not to do well with multifocal lenses, particularly the Panoptix lens. And so we're doing a vitrectomy. We're injecting the new lens in the sulcus. This is a 3-piece silicone monofocal lens. Has a low refractive index, very unlikely to cause glare for patients. So we're going to dial this into the sulcus, completely rotate it into the position where I see there's 360 coverage of the lens by the rhexis. And then I'm going to optic capture it by pushing it through or buttonholing it through the anterior capsule, which is a very stable configuration. Now we're going to go ahead and complete the vitrectomy. This is a posterior visualization system, and we're now going in back of the eye to remove the rest of the vitreous, which is a bit cloudy and there are some floaters, and this will get rid of all of that and clear up her vision as much as possible. So we do a complete vitrectomy here, inspect the retina, make sure everything is healthy and there are no holes or tears. Most of this is edited out, but we finish up the vitrectomy and remove all the vitreous. And once this is done, you can see the view to the optic nerve, and the retina is very clear. We finish that. And now we're going to switch to anterior infusion and remove the viscoelastic. And I'm going to trim some of that posterior capsule, which is now anterior to the optic because the lens has been buttonholed. And you have to be very careful when you do this not to accidentally hit the anterior capsule, because that would create problems with optic capture. And that we've done that successfully. We're injecting dilute triamcinolone to stain, looking for vitreous, and there is no vitreous in the anterior chamber, so we can go ahead and vacuum this out along with any remaining viscoelastic. Once this is done, we can remove the trocars, which are self-sealing, and the case is completed. Here's an interview with this patient the next day after surgery. Virginia, on Monday we exchanged a Panoptix in the right eye and placed a monofocal, and yesterday we exchanged a Panoptix in the left eye to place the monofocals. She was post-YAG laser, and we did this combined with plana vitrectomy in both eyes. Today she's 20/20 in both eyes. Sandra, tell me the difference between the lenses that you have in there, the monofocal lenses versus the Panoptix lenses that you had before, and what was bothering you.
These lenses are so much sharper, clearer. The light, daylight and indoor light is a lot brighter. The other lenses, everything, I mean, you could see light, but it was in a dim kind of setting. And everything reflected light really badly with the old lens.
The Panoptix?
Yes, the Panoptix.
So you felt the quality of vision was not that good with the Panoptix?
No, the quality was not there. The light indoor and outdoor was always offensive. Everything reflected light. I was mostly in sunglasses indoor and outdoor.
So now you feel you can see much more sharp and clear?
Yeah, I mean, just the day right after each surgery, the vision was just straight on.
So you're glad that you exchanged these lenses now?
It's so ecstatic. It's just such a drastic difference in the eyesight, and the clarity, and I don't have to wear the sunglasses all the time. I've been in sunglasses for 4 months. So, you know, it's just
the
great.
halos are gone too. That was bothering you.
Right, the halos. The depth perception. I can see the depth perception is already better.
What kind of work do you do?
I repair medical equipment, so
Okay.
it's very hands-on, very vision and hands dependent.
Mm-hmm. And you found you were having trouble with the Panoptix before?
I couldn't work. I had to completely come out of work. I couldn't see to drive or depth perception. So.
And you feel that now your depth perception's returned?
Oh yes,
Yeah,
yes.
excellent. All right, thank you, Sandra.